this scenario, we see a frail resident of an assisted living facility who has fallen and has been taken by ambulance to the emergency department. She is seen by the emergency physician who wants to admit her to the hospital for possible surgery to repair a broken hip. Because of her diminished health status, the physician asks about her desire to be resuscitated if she were to stop breathing. The patient does not want CPR, and the physician completes the appropriate hospital orders, as well as informs her of the POLST as a way to document her wishes. Once the patient is admitted to the hospital, the physician overseeing her care discusses and completes a POLST form with her.
Hi, Mrs. Hall. I'm Dr. Coons.
Yes.
I hear you had a nasty fall.
Yes, yes.
I've looked at those x-rays. Tell me, who's this with you?
This is my daughter.
Your daughter. Okay.
Yes.
Thank you for being here.
Thank you, doctor.
Okay. I've got bad news. It is a broken hip, and it does need to be fixed, which means surgery. Tell me what your thoughts are.
Well, if I have to have it, I have to have it. I'm in such pain.
Do you have any concerns?
Well, the success.
Yeah.
I'd like to know the chances of the success of the surgery, and will I recover completely? And
well, you're asking good questions. Yeah, we can fix the hip, and it can help you so that you can walk again. We'll need to do some rehabilitation afterwards, but that can be successful. But I do have to be honest with you and let you know that there are some other problems that we're concerned about. Your heart problems and some other health problems that you have put you at a little higher risk that maybe things won't go as well as we want.
yes,
Have you ever thought about that if things weren't to go as well as you'd like? Have you ever thought about if you were to be in serious medical trouble, what you would want us to do?
you mean if my heart failed or something like that?
Yes, but would you want us to do what we call CPR, resuscitation?
No, no.
Why wouldn't you want us to do that?
No. I had a friend at the house where I live. She fell. And they took her, and they took her to surgery, and they had to use a CPR. That CPR, and they broke her ribs.
Oh, okay.
Yeah, and she did not recover.
Oh, I'm sorry
She
to
did
hear
not.
that. Okay, that is a risk,
No.
unfortunately, and I understand your concerns. And it's fair. Your thoughts are fair because it often doesn't work as much as we'd like it to.
Yes.
So we'll honor your wishes, and I'll write an order in the chart that should this accident happen, this problem occur, that we will not resuscitate you, okay?
Yes, thank you.
Okay.
Yes.
Good. We'll go ahead and get you ready for your surgery. We'll get your pain under control.
Yes.
And when you're recovering, we'll have another doctor talk with you about these orders that you want us to do so that we won't do CPR. But you want us to be as helpful getting you back to being well as we possibly can.
Yes.
Okay.
Yes.
Okay, we'll do that then. Okay, they'll be talking with you about a form called a POLST form, P-O-L-S-T. You don't have to remember the name, but they'll be bringing it up for you and chatting with you about it. And they'll writing down your wishes and make some orders so that they'll be followed.
Yes. Okay.
Okay.
Thank you so much,
We'll take good
Doctor.
care of you. Think positively. Things will come out okay.
I will. Thank you so much.
Thank you.
Thank you,
Do you
Doctor.
have any questions?
Not at this time. Thank you.
Okay.
Miss Hall,
Yes.
good morning.
Good morning.
I'm Dr. Vincent Nguyen. I'm going to be your doctor while you're here.
Okay.
Nice to
Yes,
meet you.
Nice meeting you, Doctor.
I'm Dr. Vincent Nguyen.
I'm Donna. I'm her daughter.
Donna, how do you do?
Thank you.
And you are?
Kia.
Kia, how do you do? Nice to meet you. Miss Hall, how are you doing today?
Good.
How's your pain?
A On and off.
On and off. I heard the surgery went very, very well.
Okay.
Did you sleep well last night?
Yes.
Okay. And well, one of my goals here is to see how you're doing, and I'm going to spend some time talking to you a little bit so I can understand you better, so I can provide better care for you. Okay?
Yes.
Well, one of the things is I had a chance to talk to Dr. Kuntz, who was taking care of you in the emergency room. He mentioned to me that about the POLST form. Did you remember the discussion with him at all?
Yes.
Okay. You know, one of the things that is on this pink form, it talks about cardiopulmonary resuscitation. Do you know what that is, cardiopulmonary resuscitation or CPR?
I've heard of it. I know.
Okay. When I say about when a person has no pulse and they're not breathing, what does that mean to you?
Pretty much they're dead.
Clinically, they're dead,
They're dead.
yes. And typically what we'll try to do is, of course, we can attempt resuscitation. What it means is we're going to do what we can to stimulate your heart to get it back perfusing again through the rest of your body, the blood, or we can allow what's called natural death to occur.
And Mom, when Dr. Kuntz spoke with you, you said no CPR.
Yes, no CPR whatsoever.
Okay. Yeah, we will not do CPR when your heart stops and you stop breathing.
Yes.
But while your heart is still beating and where you're still breathing, we're going to intervene by delivering medical interventions. And one of the things that we do typically, you know, we will always take care of your pain, ensuring your comfort. And that's the basic thing that we do as physicians. But there are other things in here too. In this form, it talks about limited additional interventions. Some people prefer to have IV fluids, IV antibiotics, and doing, while they're continuing their comfort measures, but they don't want to be intubated. What are your thoughts when it comes to these type of interventions? Would you like for us to do IV antibiotics and IV fluids?
Those won't compromise the quality of her life, will they?
Oh no! In certain situation, this is going to be helpful to her, to help to alleviate any discomfort that she may have.
That's okay.
That sounds good.
That's okay. That part's okay.
Okay. There's another intervention. It's called full treatment. That essentially means I want, while I'm still breathing and while I'm still having a pulse, I want IV fluids. I want IV antibiotics. But if my heart goes into irregular rhythm, I want to be shocked. And if I have difficulty breathing, I want to have a tube down my throat and be hooked up to a machine. Is this consistent with your wants and wishes?
Yes.
Yes.
Yes, I think, yes.
So from what I'm hearing is that you want your life to be extended as long as possible.
Yes.
Okay.
Yes.
Are there any situation where this may be unacceptable to you?
Could you give us some examples?
Well, here example is one of your selection is under full treatment, where your desire is to have ventilator support.
Right.
And there may be cases or scenarios where the doctors, where you're going through a scenario where you're having a difficult time breathing. And we feel that because you're not breathing well, we may need to put a tube down your throat and put you on a ventilator for a few days to get you over the hump. There may be scenarios where we may not be able to wean you off. And I just like to know what would be important for you at that time.
Well, how would you know, or how would anyone know when I could be taken off, or if I should be taken off?
Well, being on a ventilator for a long period of time is, we would prefer the patient a person be breathing on their own. But there may be scenarios where we cannot wean you off, because if we start weaning you off, taking off the oxygen and having you breathe by yourself, you're not breathing well enough to get enough oxygen to the rest of your body. It seems like it may be a little bit hard for you to think at this time.
Well, it's a lot to think about.
And she could make a decision today for that, and then somewhere along the line, we could come back and visit it should this occur.
Yes, we can do that. We can do that, or we can spend some time for you. I would like you to think about it and discuss it as a family. No hard decisions need to make it here today. And I know this is a very difficult conversation.
Right. Well, we'd like to keep her as long as we can. That's a definite.
Okay.
Yes.
But the
not
quality
too
of her
long.
life,
Yes.
I think, means a great deal to her.
Along this line, I want to ask you another scenario. In the event should your condition worsens, and the doctors feel that, you know, the likelihood of you surviving or death is quite imminent, what would be important for you at that time?
Just to be made comfortable,
Even while you're on a ventilator,
if that's possible.
if it's possible.
If it's not possible, then it's time to get off the ventilator.
I'm glad we're having this conversation now,
So am I.
where you're able to
feel
participate.
relieved
These
that
are
they're both here to hear it.
I'm glad to get this opportunity to speak to you so I can understand your wishes. And I'm glad that you're here, Donna and Kia, to you know, so that we can participate in this discussion together. It's always good to have these type of discussion before it's needed.
Yes.
And it's important for us to understand your wishes.
Yes.
Okay. And it sounds to me that, you know, we want to prolong life, but there comes to a point in time where you do not want death to be prolonged.
So on the outset, starting with that,
Mm-hmm.
and then with Kia and the rest of the family and I, knowing what quality of life you want, we'd have to have the discussion with the doctor to say, this is the point where we have to let go and put it in God's hands.
Yes. Yes, I agree with that.
Well, I
Yes.
know these last few minutes as we discuss this has been a little tense. However, we need to know, and I need to know. Okay, but remember what I said earlier. My goal is to get you back home.
Well,
She's in a nursing facility,
Oh.
but for now, that's home.
Residential care
Right.
facility.
yes.
Okay, well, the nice thing about having a POLST form is it's going to travel with you when you go back to the RCFE so that the staff there will know exactly what your wishes are. This form will go with you when you go back home. And then we can always make a copy of this form for you so that you can keep this in safekeeping just in case it may get lost. But the copy is just as good as the original. One of the things I need to explain to you, though, is when you go to an assisted living, it is not a health facility. So in the event should emergency rises and the staff needs to contact the emergency room or call the paramedics, you may be transferred to the hospital. Okay, but the good thing though is that this form, if it's accompanied with you, the doctors and the staff will know exactly what to do.
Okay.
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 All right. So what I will do is I'll keep this, and I will give you a copy, and I will come back and check in on you tomorrow morning.
Okay.
Okay.
All right. Thank you very much.
Nice to meet
Appreciate
you.
it. Thank you.
Thank you so much, Doctor.
Donna.
Thank you. Appreciate you.
Thank you, Kia.
Okay.
Bye-bye.
Bye-bye.
Some of the key principles that you saw demonstrated include: POLST is portable and should be kept with the patient at all times. Certain medical conditions or treatments may prohibit a person from residing in a residential care facility for the elderly or assisted living. DNR and full treatment is an acceptable option for some people. It is recommended that discussion of a trial period of full treatment be explored with patients to determine if they want to limit treatment or undergo full treatment indefinitely. POLST is voluntary. The POLST conversation may be completed over time rather than all at once. Any physician or team member may begin the conversation.